If you confuse DKA and HHS, you are not alone. But by the end of this video, you'll never mix them up again. We'll break down the causes, labs, symptoms, and nursing priorities in a fast, NCLEX-friendly way. Let's get started. Welcome to Nursing Study Lab, where complex nursing topics are simplified for exams and real-world practice. Grab a pen. This is a high-yield comparison. Diabetic ketoacidosis, or DKA, is most common in type 1 diabetes. It happens when there is an absolute insulin deficiency, causing the body to burn fat for energy, leading to ketone production and metabolic acidosis. Hyperosmolar hyperglycemic state, or HHS, usually occurs in type 2 diabetes. There is some insulin present, so ketosis does not occur, but blood glucose rises extremely high, causing severe dehydration and hyperosmolality. Classic DKA symptoms include polyuria, polydipsia, weight loss, abdominal pain, nausea, and vomiting. Patients often have Kussmaul respirations and fruity acetone breath due to ketones. Compared to DKA, HHS develops more slowly. Patients present with extreme dehydration, altered mental status, weakness, and hypotension, but there is no fruity breath and no Kussmaul respirations. In DKA, fat breakdown leads to ketone accumulation, causing metabolic acidosis. Potassium may appear high initially, but total body potassium is actually depleted. HHS causes severe hyperosmolality, pulling fluid out of brain cells, which leads to neurological effects. These can present as confusion, seizures, coma, and have a higher mortality rate than DKA. Laboratory findings are crucial in identifying DKA. Some key labs include blood glucose over 250, positive ketones, a low pH below 7.3, low bicarbonate, and an elevated anion gap. The laboratory findings for HHS show a blood glucose often over 600, little or no ketones, normal or slightly low pH, and an extremely high serum osmolality. There are a few common causes for DKA. Some of these triggers include infections, missed insulin doses, a new diabetes diagnosis, trauma, or surgery. There are some similarities with HHS as well, but the common causes for HHS are triggered by infections, dehydration, poor access to water, illness, or medications like steroids or diabetics, especially in older adults. The treatment for DKA follows a specific priority. Fluids are first, then IV insulin, and then potassium replacement once urine output is adequate. Remember, Insulin is never started without checking the potassium. The treatment for HHS is different than the treatment for DKA. There is going to be a heavy focus on aggressive IV fluids. Insulin is going to be given at lower doses than with DKA because ketosis is not the issue. And as always, perform electrolyte monitoring. Nursing priorities for DKA include cardiac monitoring, strict intake and output, frequent glucose checks, and monitoring potassium and acid-base status. For HHS, nursing should prioritize neurological assessments, aggressive fluid replacements, and monitoring for thromboembolism due to severe dehydration. Here is a quick memory check. DKA equals ketones plus acidosis plus type 1 diabetes. HHS equals hyperglycemia plus hyperosmolality plus type 2 diabetes. When trying to remember which is which, think K is for ketones equals DKA, and H is for high glucose equals HHS. This is simple and exam safe. Follow Nursing Study Lab for more nursing made simple.